I'm Dr. Craig Castanet. Today I'm going to discourage you from using a pillow when you're lying on your back. A pillow on your back, and I'm going to sit here sideways for a moment. A pillow here, or anything you place here, even a small pillow, can only serve to displace your head forward during the course of your sleep. That's bad for a variety of reasons. As we get older, we tend to become more humpbacked. You notice that people become more slouched forward, or kyphotic, we call it. That's not a good thing. That results in slowly progressive deformity in the upper back. I think pillows are contributory or largely causal in this phenomenon that we see in older people. That can happen for a variety of reasons, but the most common one is something that we don't know a whole lot about. We see it, we observe it, but we don't know what is causal or contributory in it. Contributory about it. Therapists and doctors imagine that perhaps it has something to do with using cell phones or working at desks, etc. There are a lot of causes perhaps, or contributors to it, but I think lying passively on a pillow with something displacing your head forward is got to be a large contributor or largely causal in it. When your ligaments are relaxed in the neck and the spine and elsewhere in your body, they are subject to being deformed. And any influence can do that. The longer the influence, the longer the load, or the higher the load, the greater the time, the more influential it is in its influence on the shape of your spine or body parts. In this case, we're speaking about the neck and the pillow. So again, a pillow is going to round the upper back if you displace your head forward. It's going to reduce the curve in the neck, which is ideally like this. And it also closes down your airway, which is something we don't talk much about. Snoring and sleep apnea are common. That does happen typically in the soft palate. But it's a problem in the throat as well. If you flex the neck forward with a pillow, it's going to compromise your airway. Conversely, if we do CPR on a person, the first thing we do is open up the airway. They're laying on the floor supine, for example, and the first thing we do is we extend their neck to open up the airway, which is ideal. So for those three reasons, deformity of the upper back and the neck, as well as closing off the airway, I think sleeping with a pillow makes no sense. If you want to use a pillow on your side, I think you can make a case for that, because there is obviously a distance from the shoulder to the neck. And if you want to use a pillow to maintain a neutral position of your spine when you're lying on your side, that's a reasonable thing. I don't happen to use it on my side either. I find that it even kind of sometimes tweaks your neck when you're lying on your side, because the inclination is when you get up is to push off with your head like that, and that can tweak your neck. So I don't think it's necessary for many people lying on your side either. Having said that, there are limits to lying on a shoulder. You don't want to lie directly laterally on it for a long time. It's actually better if you lie sort of on the back, obliquely on your shoulder. It's better if you're on your side, or even obliquely. There's still going to be limits. It's important to move your posture throughout the night and distribute loads and stress to different parts of your body for different amounts of time, and take a break from that position. So moving side to side and on your back are ideal. You don't want to sleep on your stomach, by the way, because sleeping on your stomach means you're going to rotate your neck to some extent. And the longer you spend in a position like that, near the end range, the more stress there is on the joints. I should also note that in terms of pillow use, if you slowly become more kyphotic or hunched back as you get older, what's going to happen is, as this progresses, in order to keep your eyes level, you're going to have to extend your neck more. That increases the curve in the neck as a compensation for the increased curve in the other direction in the upper back. And when you do that, it's going to close down the little holes in the side where the nerves exit. It's going to make it more likely that you pinch nerves. It's also going to load your joints more in the back, resulting in probably more osteoarthritic changes in the neck. So That's my take on using pillows. I haven't used one for about 4 years now, and I would highly advise you stop using a pillow when you sleep in on your back. Thanks very much. If I can help you with your neck or back problems, I serve the Atlanta metro area. I'm Dr. Craig Castanet. My website is backstrong.net. You can learn more about a whole host of neck and back related topics there. I will tell you I have 37 years experience in clinical practice, including 18 years in orthopedics, physical medicine, and physical therapy, and 5 years in a neurosurgical practice, learning surgical indications and procedures. I treat neck and back problems non-surgically. Most of what I do is now spinal decompression treatment, which in my experience is far superior and much more effective, works better, faster, and lasts longer than any other non-surgical treatment I've used in clinical practice. If I can help you, call me at 404-558-4015. Thanks so much. Bye-bye.